Telestroke has been around for a while. We've just recently engaged in it because of the recent studies in stroke care over the last few years have shown that patients who receive the clot-busting medication, TPA, and then are eligible to be transferred from our institution to a higher level of care for endovascular therapy do very well. Anytime that somebody presents with stroke symptoms within less than 4.5 hours onset of time, we call an overhead stroke alert within the hospital, and then we consult Loyola. There's a certain time frame that they can have these therapies done. So that's why it's very important that they call 911 and get to the hospital very quickly, so we can decide if we can give them the medication therapy, send them to Loyola and do the endovascular therapy, or we do any other types of treatment here.
What's your name, sir?
Rick Seidler.
So the main use of telestroke services in using this robot is to expedite care for patients presenting with acute stroke. When someone presents with acute stroke, time is brain. The faster we treat a patient, the more brain tissue we can save, and the more functional a patient will be after a stroke. So the purpose of this is to evaluate a patient as soon as they roll into the emergency room and discuss with the ER physician our recommendations. It's very, very important to take a look at the patient via the robot rather than hearing the stories just over the phone. Because what you hear on the phone sometimes is very different than what I see at the bedside. And just as a neurology specialist, you know to look for other types of clinical signs, ask certain types of questions, and that helps tailor my decision making, which is crucial to a patient. So having this tool on hand is life-saving, is crucial, and decreases a lot of the mortality and morbidity of patients in the United States.